Namaste. Hello guys, welcome back to my channel. Today, I am back with another live stream. So, how are you guys? How are you feeling? How's the weather? Maybe you can hear it, but it's a little windy outside. It is sunny, but it's warm wind, so that's still fine. And I'm really excited. So, before we get started, I just want to say thank you to all those moms out there. Why? Because it is Mother's Day, and I wanted to say thank you for everything you do for us children, for us youth, for us everybody. So now let's get started. So, welcome back. What do I have for you guys today? Before I tell you, let's look at our quote. So, we cannot always build the future for our youth, but we can build our youth for the future. Think about it again. Let's read it again. We cannot always build the future for our youth, but we can build our youth for the future. Excellent quote. Okay, we're back. Today's topic is timely, but I am not alone. No, I am not. I am live today with Dr. Sabina Sadovic. Oh, it's gone again. Okay, with us we have, we're back again. So, hello, Dr. Sabina Sadovic. Thank you so much for accepting my invitation. And how are you doing?
Hello, Ella. Thank you for inviting me, actually. I'm doing just fine. I worked a night shift and my weekend started a couple of hours ago. So I'm ready and steady to talk with you on this topic.
Me too. I'm really excited. So, as a medical doctor working with COVID-19 patients, how does the situation look like? Are you seeing less cases?
Well, when we are talking about COVID and COVID cases, as you might have noticed over all this time, we can talk about it about weeks, how it changes. And I have to say that in these last 2 weeks, the situation seems to get better. We are having significantly less new COVID-19 cases. And what is more important is that we have less patients that need hospital treatment, and we have less patients with severe form of COVID-19. So it may be we are maybe getting into a stable period of this pandemic.
So that's good. Everyone's relieved now. And do you see more youth, or it's kind of stable for the younger generation?
Oh, well, I'm happy to say that since the beginning of the pandemic and till now, younger generation are somehow better. They are going along better with COVID-19. There is just a small number of youngsters who needed hospital treatment. The most of young people get along with COVID just same as with a cold, and they are treated at homes. So it is much better situation with COVID-19 and younger generations.
So thank you so much for that answer. That's also a relief. And thank you so much for the real life feedback.
You're welcome.
So, in times of crisis and disruption, young people are vulnerable to long lasting impacts. COVID-19 has disrupted young people's education, mental, and social well being. So, Dr. Sadovic, tell us what are your observations in the impact of COVID-19 on youths?
Well, what I can say is that this pandemic has affected all children of all ages and in all countries, and especially all those actions that are done to contain the disease. And sometimes I think it may do more harm than good to children, you know. It's because globally schools are closed, and in some countries they lack on resources to switch to digital learning, and also there are poorer households and that children don't have even access to the internet.
Mm-hmm.
So we have, I mean, children have lost in that way, but also in countries where everything works perfectly, where everything is well organized, children may be unable to learn because of skill gaps among their teachers and because of lack of parental guidance and support, you know. So it's not easy to educate in this COVID-19 era. And also what is problem is that with these school closures and also many events are canceled, teenagers are missing out on their biggest moments in their lives. There are
Mm-hmm.
so many big moments that you can experience in your young life, and missing it out can cause you feel sometimes isolated, disappointed, even anxious. So it's not easy for all of you there, you know.
Yeah.
But what
Oh,
I have
we have
to
a comment. We have a comment. We have a comment. We have a comment.
yes.
It says, "Hello, Ella. Good." Ah, what's happening? I don't see the comment anymore. Good. We'll read it after.
Ah. So what's important for you youngsters to know is that these feelings, such as to be insecure, what is going to be, and to feel even anxious and sometimes sad, it's perfectly normal in this situation because it lasts too long, and it's perfectly normal. And what I can tell you, it is actually good because all this stress makes you think what you can do to keep yourself safe and other people too. So you are keeping physical distance, you are washing your hands, you're not touching your face because you think about it. So it's on one side it's good, but on the other side it's not easy to cope the day with all those feelings. So what I would recommend to you is to try to find some distractions, you know.
I think I have some distractions maybe to do.
Like
Because
what?
I have a lot of things that I like to do when I'm stressed. For example, on this COVID-19, and I like to read. I like to draw, and I like to read, and I like to draw. And
And
a lot to draw what's around me and what's happening and how I feel. That's what I draw a lot too, and it helps a lot.
and did you try out to start something new I mean, I've noticed that you started your live streams and meditation and yoga for youth. So it's something that came along with in this situation. You had some more time, so you came up with new ideas, and that's what I recommend to all of you, to try out new things,
Yes.
and also to try to connect to your friends. And all these social media and social platforms allows you to do that. And I mean, I would never think that I would say that you can use in these times also TikTok, Facebook, Instagram, Snapchat, etc. It will help you in these times.
Mm-hmm. Do you see the comments? Yes, but I cannot read this middle one. It's easy for adults to say, keep calm, your time will come, but it's difficult for young people with limited experience in life.
What do you think, Ella, about it?
It's really true. Because I think every single kid had that time where an adult says, keep calm, it will come, just wait and it will come. And just impatient, like if it's your birthday and 2 weeks before their presents are standing, you're impatient to open it. Like you're impatient for your turn to come, for example. So it's, yeah. Yes.
Okay.
Despite the situation, youths must still play an important part in recovery and reconstruction by expressing their concerns to get better help and support, and also be of help to those in need. So,
What do you think? How youth can help in all of this to be easier?
I don't know.
Tell me, is it sometimes? I mean, what I thought when I was a kid, but when my parents tried to explain me something, they would never succeed it. Sometimes I needed to talk with my friends so we discover what it is about. And what about you, Ella? Are you worried about the situation? And what about your friends? Do you talk about it?
Well, not all the time. I don't really talk about it with my friends because most of the time when it comes on TV, I never understand it. But yes, I am worried because one, I wonder what life will be like after COVID-19 and what will change and what change it might bring. I'm also worried that when long distance traveling might happen again, and if masks will be the new outfit, we must always wear. 3, I wonder when it will be possible to have these big, normal family gatherings we always used to have. And 4, I also wonder what the future might hold from us. How will this impact in the long run? And when we get older, will teleworking be the normal? Will it be what we do every day when we work?
Oh, okay. There were many questions. So, okay, first of all, how do you feel when I tell you that maybe there won't be after COVID-19 time? What if COVID-19 stays with us all the time?
Well, I'll be really annoyed because Like I said, I don't want masks to become an outfit, because it's fine wearing them, but just not all the time, because sometimes we need some fresh air, and sometimes the mask just doesn't help for that point. And it would also be really annoying because we have to be in lockdown, then we go back to school, then we're back in lockdown, and etc. and etc. And it starts all over and all over again. And that we also won't be able to see our friends, and we won't be able to learn and all those type of stuff.
So it seems like you're fed up with all this situation and restrictions. So I asked you this because, you know, the virus won't just disappear, you know, but also we are not just staying at one point and not doing anything. So the virus won't go, but we can do something about it. So what we are trying actually to do is to adapt to living with COVID-19. So
Which will be
that's why
hard.
we are developing vaccines, you know.
Mm-hmm.
So we will avoid COVID-19 in the best way possible, you know.
Mm-hmm.
So with all those vaccines that are developed by now, there will be less infected people, and the new cases will always have mild forms, you know. So I'm I'm sorry for telling you that COVID-19 won't disappear, but at least we will put it under control and, you know, try to save us despite COVID-19. So that's about the first question. So it won't disappear, but we are giving our best to control it. And what was the other question, the second one?
Yes, exactly what's on the screen.
Um,
I wonder when long distance traveling might happen again, and if mask is gonna be the new fashion that we always have to wear.
okay, you're not excited about the mask fashion, as I can see. So about traveling, well, you know, there's something in science, there are some percent that we are following. So uh, for example, in Europe there is a plan to vaccine at least 70% of all people
Mm-hmm.
by the end of the summer, and then we accept things to get a bit more normal, you know.
Mm-hmm.
So I think that afterwards we can at least travel within Europe borders, you know. It's a good thing. And about the mask, well, I'm not sure when we are going to get rid of them. I'm not fan of them as well. They are restrictive in so many ways. But let's see how this with vaccines works out, you know. So then we will see what to do with the masks, if we need them or not.
Yes.
Okay. And what's the next question?
The next question is, Stefan Weiser has a comment. We will able to handle it.
Like the year before.
Yes.
Exactly.
So,
I agree with this comment. I hope to get on that stadium when it will be just like a flu.
mhm. And the other question was, I also wonder what the future might hold from us. What will be the impact? How will the impact? How will this impact us in the long run?
Okay. So, well, we never know what tomorrow brings. We did not know it with COVID-19 as well. So we got so surprised, and we lost our compass, and we couldn't organize well for a long time. So I think that in the future we should focus on how to be more flexible and adaptive and innovative. And I think that you youth are our future, actually. You can bring out new ideas and new solutions.
Mm-hmm.
And about, you mentioned also teleworking, if it's going to be normal or not.
Yes. When we get older, will teleworking be the normal?
Well, teleworking was a topic even before COVID, but it wasn't so popular because we human beings like to interact with each other in person. But nowadays, I mean, in this situation with COVID, it's something that is must, and I think in the future it will be completely normal for your generation. Teleworking is future.
So that basically means that if COVID will disappear, um, it will be kind of like two options, kind of like doing it from home or going back to the office.
Yes, but
Okay.
I really hope if people choose to work from home, they try to keep up with their hobbies and social events, and not just staying at home. It's not healthy.
Yes. And I think COVID-19 will open new doors and new ways of doing things. Example, we will really appreciate the time we spend with our loved ones, like always.
Exactly. I could not agree with you. And oh, I see some question coming up, popping up.
Yeah.
Uh,
Oh, I can't read it. There's something in the middle. I can't read it. And you, doctor? Well, thank you so much, Dr. Sadovic, for your time, and I hope to see you soon.
Thank you, Ella, for inviting me. It was very nice conversation with you. See
That was
you.
really fun. Thank you. Bye.
Bye.
So, guys, I hope you liked this video. If you liked it, make sure to like, share, and subscribe. And I'll see you next time with a new live stream.